Vanakkam, good morning. In this video, we are going to discuss about the vestibular apparatus physiology. This is the important topic in the central nervous system. It may ask us the short notes in the university examination. Bony labyrinth. This is the image of the bony labyrinth. It is located in the petrous part of the temporal bone. So it has the coiled structure. This is called as the cochlea, and it is connected with the saccule and utricle. So this is the vestibule. It is connected through the semicircular canal. This is the bony components. So inside the bony part, it has the membranous labyrinths within the cochlea, and within it is semicircular canal. So between the bony labyrinth and the membranous labyrinth, it contains the perilimb. So inside is membranous labyrinth will be there. In between the membranous labyrinth and bony labyrinth contains the perilimb. It is similar to the extracellular fluid, high sodium, low potassium. Within the membranous labyrinth, it contains the endolimb. It is similar to the intracellular fluid. It has the high potassium, low sodium. Okay. So in the saccule utricle, it has the sensory epithelium. It is called as the macula. In the semicircular canal, the dilated portion is called as the ampulla. This is the anterior. This is the posterior. This is the lateral semicircular canal. This image shows the membranous labyrinth. This whole part is called as the membranous labyrinth. In this image, the vestibular apparatus consists of utricle, saccule, and semi-anterior, posterior, lateral semicircular canal. So cochlea main function is the hearing. It is used for the hearing, cochlea. And vestibular apparatus important for the balance and equilibrium. So it is carried through the vestibulocochlear nerve. The utricle saccule is important for the static equilibrium. So when the person is not moving, that time it maintains the balance. And the semicircular canal is important for dynamic equilibrium. When the person is moving or rotating, angular rotation, that time it maintains the balance of the body. In the vestibular apparatus, utricle and saccule are called as the otolith organ because it contains the calcium carbonate crystals. So it is called as the otolith. The calcium carbonate crystal is otherwise called as the otolith. So it is called as the otolith organ. The utricle, the saccule contains the sensory epithelium, that is called as the macula. The hair cell is arranged in the horizontal axis. So it is important for the horizontal linear acceleration. Okay. So when the person is moving in the horizontal direction, when the person is traveling in the bus or train, so that time it is helpful to sense the balance and position of the body. And the saccule is in the saccule, the hair cells are arranged in the vertical position, the vertical linear acceleration. So this saccule is important when the person is traveling in the lift, elevator. So that time it sends the position of the body and maintain the balance and equilibrium. Both utricle and saccule important for the static equilibrium. When the person is not moving, so that conditions it sends the balance of the body. And the macula is the sensory epithelium present in the utricle and saccule. Utricle and saccule is called as the otolith organ. Inside the utricle saccule, the sensory epithelium is called as the macula. In the macula, it contains the hair cells. The yellow color is the hair cells, and the green is the vestibular dark cell. It produces the potassium ions, secreting the potassium ions. This is the supporting cells. In the otolith organs contains this is the calcium carbonate crystals. This is called as the otoconia. So calcium carbonate crystals present within the otolith membranes. The hair cells embedded in the otolith membrane. So in the presence of the otoconia, it makes a gel-like substance. This specific gravity is more than the endolymph. Endolymph contains more potassium ions and less sodium ions. So the otoconia has a more specific gravity than the endolymph. When the person is moving in the horizontal directions or vertical directions, so it this is the largest cilia is called as a kinocilium. The smallest are called as the stereocilia. When the person moving in the horizontal direction, the bus or train, that stereocilia bend towards the kinocilium means it produces the depolarization, sends the impulse through the vestibular nerve to the vestibular nucleus and maintain the balance. So when the person is stopping at the resting conditions, the stereocilia is away from the kinocilium. It will produce a hyperpolarization. It will occur in the when the person is traveling in the bus or when the person is moving in the elevator. That condition is helpful to sense the static equilibrium. Ampulla of semicircular canal. Ampulla is the dilated part of the anterior, posterior, lateral semicircular canal. It contains a sensory epithelium that is called as the cupula. It contains ampulla is the dilated part of the semicircular canal. Cupula is the sensory epithelium. Sensory epithelium, it sends the angular rotations when the person is moving. That time angular sends the angular acceleration. It is important for the sense the dynamic equilibrium. So in the moving rotation, that hair cells present in the cupula sends the angular acceleration, sends the impulse through the vestibular nucleus. This is the crista ambularis. The hair cells are located in the hill-shaped crista ambularis. The vestibulo-ocular reflex. So when the person moves, rotate the eye from left to right side. When the person moves the eye from left to right side, so that condition, the angular acceleration is sensed by the ampulla of the semicircular canal, the both right and left side. So here the eye is rotating towards the right side, but the endolimb within the ambula is moving towards the center, ambulofetal movements. So it move the hair cells from the stereocilia to the kinocilium. So it sends by the vestibulocochlear nerve through scarpoganglion, and it reaches the medial side of the vestibular nucleus. So the four nucleus, lateral, medial, superior, inferior, it reaches the medial side of the vestibular nucleus and crosses to the sixth cranial nerve nucleus, and from the sixth cranial nerve nucleus it contracts the lateral rectus muscles and uh, medial rectus. Right side is medial rectus, through it reaches the third nerve nucleus, it produces the contraction. Okay, when you are moving the eye, it is contracting the lateral rectus and contracting the medial rectus. So when you are moving the head, the eye is seeing contraction is occurring in the lateral rectus and medial rectus. But in the left side, what happened? The endolimb is moving in the ambulofugal movement. This side, it produces a hyperpolarization. This less stimulates the vestibular nucleus and reaches the sixth nucleus. It is less inhibit the lateral rectus in the right eye. Same time, it reaches the opposite third nerve nucleus. It inhibits the medial rectus in the left eye. So this is the vestibulo-ocular reflex. When we are moving the one side, right to left side, means it produces the contraction of the lateral rectus in the left eye and contraction of the medial rectus in the right eye. Okay, same times it inhibits the medial rectus in the left eye, lateral rectus in the right eye. So this is the vestibulo-ocular reflex. It is carried by the vestibulocochlear nerve to the vestibular nucleus. Sixth cranial nerve nucleus called as the abducent cranial nerve nucleus. Sixth cranial nerve nucleus supplies to the lateral rectus. The medial rectus is supplied by the oculomotor nerve, cranial nerve. Apparatus. So it is important for the postural reflex through the vestibulospinal tract. It is maintained the posture by the reflexes like tonic labyrinthine reflex and writing reflexes. It is sensed through the vestibular apparatus. It is important for the maintain the posture through the spinal motor neurons. And through the connection with the cerebellum, it is important for the balance the position of the body. And vestibulo-ocular reflexes, in the angular rotations, produce the visual reflexes like vestibulo-ocular reflex. It is also helpful for the maintain the equilibrium of the body. So it is mainly important for the posture, balance and equilibrium. Static equilibrium is controlled by the utricule and saccule. Dynamic equilibrium is controlled by the semicircular canal. Thank you for watching this video. If you like this video, share your friends. Those who are not subscribed this channel, please subscribe. Thank you once again.